But again, thank you everyone for attending our session today. Again, it's Power in Partnerships, Lessons Learned from Aging Services. Today we have a wonderful session for you and to finish out our series on building collaborations and partnerships between HIV and aging services. So in the chat, if you can go ahead and drop your name, your organization, and your role, just so we have a good sense of who is in the room with us today. And this session is being recorded, so it will be distributed after the session as well for your own review. And with that, let's start off with some Zoom housekeeping here. We have a dedicated Q&A break at the end, but please feel free to drop your questions into the chat and we'll keep track of them as well. Please mute your microphone while you're listening, just to make sure that our presenters and different audience members are able to engage with the speakers and the content. And there is a button on your Zoom screen as well to show captions to help you follow along with the presentation. And if you weren't able to join us for our project showcase last week, our materials, our recording, and all of our project posters are available on our Training and Health Equity Collaborative website. The QR code is there, and the link is going to be dropped into the chat as well. So thank you everyone for joining again. And if this is your first time to one of our learning collaboratives, we are funded through the Gilead HIV Age Positively Initiative, and we serve HIV and aging programs shown throughout the Western United States. But many people come from across the nation to join our trainings as they are broadly applicable. We promote health equity by sharing strengths of all healthcare team members, including nurses, physicians, administrators, and caseworkers, and home health workers as well. So please take a moment to fill out the evaluation at the end of this session to make sure that we understand how we did and how we can improve future training opportunities. And these are our learning objectives today. By the end of the session, you'll be able to go off and start building your own partnerships to help make HIV and aging services more inclusive for your clients. Partnering is absolutely necessary to help create fully comprehensive service networks for people living with HIV over 50. Because as we know, people have more touch points with the service system as they age. So as many people as we can get trained up on the specific care considerations around HIV and aging, the better. And before we start, I want to start with a land acknowledgement, and that UCSF is based on Ramaytush Ohlone land. And with our work here at the Training Health Equity Collaborative, we want to make sure that we uplift and collaborate with Indigenous people here and wherever you may also practice, to pay back to the original stewards of this land. And without further ado, it is my pleasure to introduce Jack Newby. He is an experienced leader utilizing his experience in both the HIV and aging sectors. So thank you for joining us, Jack.
Well, thank you very much for that introduction. I appreciate that, and certainly happy to be here. For everyone that's watching, I'm coming from Palm Springs, so it's entirely appropriate that we have that glare from the sun for a few minutes on my shoulder. So I was asked to do this, and my experience over the last 30 years in nonprofit work has involved program development, fund development. I've been director of development for a couple of organizations, strategic planning, grant writing. I've also done work with HIV advocacy work with one of the organizations here in Palm Springs. So we can go to the next slide. So I'll take a moment talking about my own journey in aging and HIV, and personal and professional kind of intersect in that area. I was working at the Long Beach Gay and Lesbian Center at the beginning of the AIDS crisis, and also when free anonymous HIV testing came into being. And we were one of the first in the nation to offer that free anonymous HIV testing. We felt it was important that people knew. And for those of you that can recall, in those days, we were told that there would be a vaccine right away. So it was good to know what your status was. There was certainly a lot of controversy at that time, and many organizations, the Gay and Lesbian Center in Los Angeles was not going to be doing that testing because they were concerned that we may be rounded up and put into camps. And that was, those were real concerns at that time. My personal journey started at that same time because I, being an advocate for having this testing program, was tested and found out that I was positive at that time. It was a few years later that symptoms began to manifest, and the doctor I was seeing at the time, that was just when AZT was coming out, and the doctor I was seeing at the time, I approached him and I said, well, what about this new antiretroviral? Can that be helpful? And ultimately, in retrospect, I'm kind of glad that it turned out the way it did. But he looked at me and he said, well, it's too late for you. Needless to say, I found myself a new doctor and was fortunate enough to end up in the offices of Dr. Michael Gottlieb. So many of you knowing the history of HIV and AIDS, Dr. Gottlieb was the top doctor and the person who, with a great deal of damage to his personal career, wrote the first report of this new disease that he was finding among gay men in Southern California. So we can go on to the next slide. So for HIV long-term survivorship, I think there are both opportunities and challenges. We have, through these years and through our own personal advocacy, increased our resiliencies and self-efficacy. I know for myself and for a lot of people that are long-term survivors with HIV, we learned how to talk to our doctors respectfully, but also telling them yes or no, I am or am not going to do that treatment. Or I want to hear more about what treatment you're recommending and what are the side effects of the medication. So for the long-term survivors, we've learned how to navigate the medical system and how to talk with our doctors. Also, community advocacy and empowerment. We wouldn't have many of the drugs now without, an early, the ACT UP groups, and many of us were part of that, or many of us in many ways advocated and worked very hard to make sure that we had the necessary help and necessary support from our community. I remember one of the things that I worked with when I was in Long Beach was hospital visitation, because many times, because we weren't married and we had no legally recognized relationship at that time, the hospitals or the families of our partners could say, no, you can't come in and visit this person. So one of the early advocacy things that I worked on was hospital visitation in Long Beach. And there's a whole story in that, so I won't go into it, but it was pretty amazing, some of the things that were said and done by certain members of the Long Beach City Council. Challenges, stigmas and prejudices. And of course, for those with long-term survivorship, certainly at the beginning, a lot of people did not know how HIV was transmitted. They thought that you could be in the same room with someone and acquire HIV. So there was a lot of stigma associated with that. And I'll also say there was some stigma. Then I call it, it was the second coming out for me. Um, Letting my community of gay men know, and gay and lesbian uh, community know, that I was HIV positive. And many of us can recall that there was a lot of prejudices and stigmas related to men, especially if you were in the dating scene. Um, so that was one of the things that we learned to navigate that. Social restructuring and isolation, creating our own groups and ways that we could work together to really alleviate isolation. And then AIDS survivor syndrome. And so let's go to the next slide and talk a little bit more about that. So AIDS survivor syndrome really is a constellation of symptoms and issues that arise for older adults living with AIDS, and who have lived with it. I'm 71, so I've lived with this for an awfully long time, uh, and there's mental health certainly is one of the issues that arises for people living with HIV over the long term. Not only the mental health aspects related to um, the diagnosis of HIV, but also the mental health aspects related to uh, our relationships with other people, our uh, depression or anxiety over various drugs and the reactions that our bodies have to them, and the reactions that our bodies have to the virus itself. So mental health covers a lot of aspects for those people who are called AIDS survivor. Behavioral health, many of the same things. Social health, again, working with individuals and working within our community can sometimes be very challenging. Uh, it's changed a lot now with the uh, advances in medication and in treatment. So the but some of those behaviors that we learned as older individuals living with HIV/AIDS still manifest themselves. Also, self-image. Uh, Many of us have been impacted by drug side effects that can leave uh, physical, uh, both internal and external physical problems. So self-image is one of those things. And then survivor's guilt. And that's kind of, there's AIDS survivor syndrome that manifests itself for some people that don't have AIDS. They, how did I get through this unscathed? I didn't do anything different than my friend who either passed away many years ago, or who is living with the challenges now. So there are many people who don't live with HIV/AIDS that have AIDS survivor syndrome, and then there's survivor's guilt from those of us that uh, have lived these many years. And I remember when I was moving to San Francisco for work, and going through things so I didn't have to move a whole lot. And I had heard this said in a basically in a presentation, and it was true for me also, is that, I basically buried my phone book. At that time, we didn't have smartphones. We all carried little books with addresses and phone numbers. And in looking at that, it was tragic when I saw the number of people who were part of my very close friends and kind of posse, if you will. Um, they were gone. So that's something survivor's guilt can uh, impact those of us who uh, do not have HIV/AIDS, and those of us that do, in many different ways. So let's look at the next slide. So this was from an event that we did, this photograph. And I don't know if you recognize him, Greg Louganis, the Olympic diver who later came out with HIV, disclosing that he had HIV/AIDS. He was our featured speaker. But the healing power of senior centers, and sometimes people laugh at me when I talk about this, they are really, I call it a miracle, because I've seen miracles happen from individuals participating, older adults participating in senior centers. They are dealing with loss of a spouse, loss of a loved one, partner, and they're rebuilding their lives. And this was actually very personal to me because I saw what happened with my mother. My parents were married nearly 50 years. My father passed away. My mom was alone, and she found the local senior center and became involved and rebuilt her life. And to me, that was a miracle. So that's what I call the miracle of senior centers. And they're designed to provide services for all older adults. And one of the discussions we had in preparation for this was, how do senior centers integrate individuals living with HIV/AIDS? And my response to that, and we'll maybe go into this a little bit more later, is that nobody asks. So if you want to go to an exercise class and you are older living with HIV/AIDS, you can go to that exercise class. There's no questionnaire. There's nothing that asks you about your history. So a lot of times some of that stigma and some of that reticence is in ourselves for participating. And the services, that's one statistic in preparing for this I ran across, is there are close to 600 senior centers in the state of California. So virtually in every community, there's a senior center. Some of them are through the Parks and Recreation Department of the city. Some are nonprofit organizations, which are the ones type that I worked with. But you can find senior centers virtually anywhere, and they have very similar programs along the way to support healthy aging. And that's the whole idea of the senior centers, to connect seniors with each other, to provide services and programs where they can make the best of their lives and meet new people and create new relationships. And again, that's the miracle of senior centers. And it also addresses, and again, we'll be talking about this a little later, is loneliness and isolation. And that is really the recent Surgeon General's report talked about the really epidemic of loneliness and isolation in the United States, pertaining to all age groups. But when we talk about loneliness and isolation in older adults, it can have the same adverse health impact as smoking about a pack of cigarettes a day. And you may say, well, how can that be? But if you think about it, if you are not engaging with other people, if you are not exercising on a regular basis, that can affect in all the systems of your body. And so you can lose muscle mass, you can lose your ability, your cognitive ability, your cognitive decline may increase because you're not socializing. So that's a magic medicine, is keeping active, keeping engaged, and being around other people. Let's dive a little deeper in the next slide. So when we're working with a local senior center, or if we're a senior center and we're designing services, consider factors. You want to meet the seniors where they are. And so you may want to make sure you have programs and services, for instance, in Spanish. So you can outreach to the Spanish-speaking community in your area. Cost. It's very important that in a senior center, or if you're developing senior programs, that the cost be very, very low or free. And through experience, I can tell you, you can charge $5 for a class, which doesn't sound like a lot, but for seniors living on fixed incomes or low income, especially those that may have retired earlier and are now in their late 70s or 80s, they may be living at or below poverty level. And so that $5 fee is a barrier. And that's ties in with providing services to lower income communities. And meeting them where they're at. So that might be a food program or a farmer's market to make sure that they have adequate nutrition and things that are fresh. And doing that, you don't have to do it all yourself. Developing collaborative partners with here in the Coachella Valley, we have Fine Food Bank that I've worked with to bring in farmers markets and also food pantries. We have other organizations that we collaborate and work with to provide services to a diverse number of people. Habitat for Humanity is an example. I thought they just built houses. But here in the Coachella Valley, they have a program for older seniors who may need a new water heater, who may have some deferred maintenance in their homes that need to be addressed. And they'll provide that to anyone, any senior or older adult that qualifies for their services. They will provide them, whether they're HIV positive, living with AIDS, doesn't matter. So many of the service providers we can bring in and work together and create equitable and inclusive programming, and working with other organizations, you can increase your client reach and your organization's impact. And working for the Jocelyn Center, one of the programs we had was a counseling program, and we worked with a senior center in Indio, as well as worked with other organizations that provide a volunteers in medicine, which we actually have. It's free, and physicians volunteer for that. We provided Spanish-speaking counseling services for their patients, and they didn't have that. So that was a significant addition to their services that they were able to provide. So let's move on to the next slide. So we have to first assess our readiness before we do this outreach. And do we have any preconceived ideas or barriers? And I touched on that earlier. Sometimes we may think that because we're providing services for people living with HIV, older adults with HIV, or even older adults with who are trying to access those services, we want to let them know that sometimes it's in our head, those preconceived notions and barriers, that organizations, nonprofit organizations in our community are very open to working with individuals that need services. It helps them provide the services and to be able to meet the goals that they may have. And are we ready to come out and actively seek collaborations? So that's another example that I've worked with is HIV Aging Research Project in Palm Springs works together with a number, probably 15 or more community collaborators in presenting an aging positively program on an annual basis. And that's where Greg Louganis was the speaker. So that's something we want to actively seek, those collaborations. And who can we work with? So look into your community, develop that resource list of people who may be able to provide services to your clients. And again, I'll tell you, they really uh, aren't going to exclude you because your clients are predominantly HIV positive. And in fact, like I said earlier, in many cases, it doesn't even come up. So let's move to the next slide. So working with your partners. First, is training needed for staff? Is it needed for your staff or for the partner you're working with, to let them know? Some people are still living with those old ideas regarding HIV/AIDS. So to let them know that people may be accessing their services and they really have nothing to worry about. Most people, especially people, older adults living with HIV/AIDS, we're on the medications that we are undetectable, and it's something that's really not a concern anymore. And I had someone ask me, well, in an exercise class, what if someone injures themselves or bleeding or something like that? You know, the trainings that I've had, they're universal precautions. So whether a person is HIV or positive or not, you have universal precautions where you don't want to get in contact with blood or other bodily fluids. Your staff supportive of the cultural aspects of well-being and aging. And that's really something. There is ageism, trust me. And we see it in our own community, and we see it in the larger community, that well-being and aging and older adults, there are some cultural aspects that we need to overcome when we provide these services, and thinking that maybe that person who is older can't do a certain thing or shouldn't be doing a certain thing. And again, the miracle of senior centers that I've seen is that I've seen someone come into an exercise class in a walker, and after several months of regular participation, they don't need that walker anymore. So there are some real opportunities to change lives and the lives of your clients by collaborating with other organizations. So let's move to the next slide. So how do you introduce the subject of HIV to an older group? Let's move to the next slide. You can do seminars on safer sex, and trust me, older adults have sex. And we've seen, I think, I don't know whether the statistics are still the same, but older adults in Florida and in many areas are really one of the areas that receive the largest growth of HIV infection. So we do want to make sure that we provide seminars on safer sex, provide information on and HIV testing on a regular basis. And we did that when I was at the Joslin Center. We worked with Desert AIDS Project and did HIV testing and provided information. We had safer sex kits available in the lobby, and believe me, they had to be replenished on a regular basis. And then also helping your local HIV service providers promote their services. HARP PS does various seminars and educational programs for their community. We included that in our emails to our members, so they would know what's happening, promote their services or their events. Let's go to the next slide. So promoting events such as AIDS Walk or World AIDS Day. Those are things that you can do, or even do a World AIDS Day event in collaboration with uh, some of your community partners. Help sponsor events. And this slide has an image. Jocelyn Center's Arthur Newman Theater is where we did this September Aging Positively project. We had Jack McEnroth as our guest speaker. And so the Jocelyn Center helped sponsor those events, and providing not only the space, and also we provided lunch. Participate with teams in AIDS Walk. If one of your local HIV service organizations has an AIDS Walk or does a World AIDS Day, participate in that openly as your organization. And several times the Jocelyn Center had a team in our local AIDS Walk. When I worked for the Mizell Senior Center here in Palm Springs, the same thing. And then we also had a booth or table at AIDS Walk and at other community events. So collaboration is a two-way street. We really want to work with both parties, and make sure we're doing mutual promotion of events, collaboration with each other, because that's the important thing, that it's a two-way street, and that you avoid at all costs having your collaboration turn into a competition. You're not competing with the other party. You're not, we'll get these numbers for our grant, something like that. You want to make sure and spend time when you are working with your collaborative partners in the community, to make sure it doesn't turn into competition, because that can be very disappointing, both for the participants that you're hoping to reach, because they feel like they're somewhere in the middle, and also for the organizations that are involved. It is just not a good scenario. So let's go to the next slide. So how do you directly address the epidemic of loneliness and isolation? As I mentioned earlier, that's a major, major issue currently facing the United States, and really facing people living with HIV/AIDS over the long term, and generally older adults. So exercise classes. Of all levels, you'd be very surprised. Yoga, something that people can do, whether it's chair yoga and they can graduate to regular yoga, some sort of exercise class, and make it as varied as possible. The one we did for free at the Jocelyn Center was Go for Life, and it was based on a National Council on Aging program of that name, but the four really involved and referred to strength, if I can remember them now, strength, endurance, balance. So all of those things we want to include in our exercise classes to make sure we address those. And balance is one of the most serious ones that we want to address. I'll talk about this right now. The importance of exercise classes and keeping active. So many of us, as we grow older, we don't want to go out, we don't want to exercise, we're afraid we're going to fall if we go out, and so we stay at home. Well, that increases the likelihood that you will fall. Inactivity increases the likelihood that you will fall. You have to keep your muscles toned, exercised, and strong. Arts and crafts are a great thing. I know people, I kind of have to laugh at this, they've retired and they've created a new career as artists. And just something that will keep the mind engaged. And also arts and crafts in a group situation is really important, because you may see them doing a little bit of their arts. Most of the time they're talking, the participants are talking with each other and engaging and building relationships. Same with card and other games. And then also social services. If you have mental health counseling, or if you have case management, the issues and the needs that a person who is older living with HIV and AIDS are the same as someone who is not. They may need affordable housing. They might need food support. They might need other supports that your organization can provide, regardless of whether a person is living with HIV or not. So let's go to the next slide. Oh, questions. Did I cover everything?
Yeah, feel free to come off mute, raise your Zoom hand, and thank you, Jack, for your presentation on really the power of senior centers and how we can make them more inclusive through both training and also understanding like our own partnership goals. So do you have any questions from the audience before we move on to our activities today? Okay. Let's see. So if there are no further questions, feel free to drop them in the chat. Oh, and then we have Shakina. Did I say that right?
You did. I'd like to ask, going through all these loneliness and getting involved in all of the different ways that we can, break the loneliness and isolation. Is there stigma? Do people experience stigma when they're doing some of these activities in a public setting where they're feeling vulnerable for falls or balance? How is that addressed?
Well, Mr. Lucky number, because we have been around for 12 years as
well. I'm not sure what type of stigma you're talking about, stigma related to HIV or just aging in general, but related to HIV, I'll just mention I've been involved in senior centers and providing services for seniors for over 20 years. It's never come up. When a person is enrolling in a class or participating in a class or activity or social, it never comes up. It may come up if they bring it up and share that with someone. And I've still not seen the stigma all, relate to you. There was, when I was at the Mizell Senior Center, there was a group, this wasn't necessarily HIV/AIDS related, but it was a gay men's group, and they were meeting there, and they said, people are talking about us. They're asking about us. And it really wasn't, they weren't pointing, or if they were pointing, they were pointing out, oh, there's the gay men's group, but it wasn't in a way that was stigmatizing. It was a way as identifying who that was. And in fact, at the Mizell Senior Center, we hired a transgender individual, and she was welcomed with open arms. In fact, she taught computer classes and people loved her because of her background and her knowledge. So there may be some initial reticence on our part in terms of becoming involved, but I truly have to say, and it may be because I live in this wonderful area of Palm Springs, but I have never seen it happen.
That's what I was speaking to. Across the United States, you are living in a bubble. I'm living in a relatively bubble. I'm also listening to Pasha, and I'm I'm asking this question in particular for people in the South, where living with HIV and aging is really challenging in even greater ways than living in a bubble. So I was just speaking to that particular kind of picture and how challenging it might be, as opposed to being engaged, breaking down the loneliness and making connection.
I mean, you are right. We are, many of us, living in a bubble in certain areas. Other parts of the country, what I've experienced, and I've seen this, my in-laws live in Iowa. So there is maybe an initial questioning, and then and sometimes you have to meet people where they're at. I don't necessarily agree with some of the things that I see and hear, but I don't take it personally. That's where they're coming from, and so I think it can be in areas like that a kind of graduated introduction. And that's what we talked about earlier, even in these areas where we may be living in a bubble, or it may be, more widely accepted. But there still needs to be some training. People are still kind of in the dark about individuals living with HIV and what the challenges may be. So I think taking it step by step, not having the expectation that you're going to go from A to Z right away, meeting people where they're at and understanding how they got there, and then helping move them along. And it can be definitely a process, and definitely we have to be committed to it, because trust me, it's going to push some buttons.
I really appreciate all of your input. I'm working with Pennsylvania Governor Josh Shapiro in the LGBTQ Commission Aging Working Group. And this is a really important topic, and I really appreciate the effort and the amount of time that you put into answering it. We are a very diverse state in terms of how we're able to meet people. And so it's why I'm here today, to learn.
Well, I hope that I've given you some insight or assistance or ways to look. And if, I don't know whether JB has shared my information, but, I'd be happy to brainstorm with you to think of some ways that we could address those difficult situations and issues. And I mentioned earlier at the very beginning, in Long Beach, in the fight for hospital visitation rights, and the quote that happened, and I ended up being asked to write, a front page editorial about this in the local newspaper, was one of the council members actually said this: what are we going to have next? Somebody walking down the aisle with their favorite UEWE, I think it's spelled, and which was just a horrible thing to say. And we talked with the mayor and we worked through it, and I was asked to write this, it was kind of like dueling articles. And that was a very hurtful experience. And yet, when you're met with those experiences, you can either retreat or meet them head on. And I've always found you get a lot farther meeting them head on, and not letting individuals that may hold views like that get away with it.
Perfect. Thank you, Jack, and thank you, Shakina. Sorry, I'm trying to find your name again. And really wanting to mention again the importance of education in destigmatizing HIV and also ageism, because there are a lot of assumptions or a lot of yeah, there are a lot of assumptions on how HIV is transmitted, what older adults can or can't do, and what they're capable of, and how they want to receive services. So really understanding, where does our work start? Does it start with more of that education of what is HIV, what is aging? Or can we get right into the, oh, let's build a partnership because we understand one another? So going from A to Z may not be entirely clean and concise in the ways that we will think it is, because we all work with people and we know how complex people can be. And I see one more hand from Sherry, so go right ahead.
Good morning. Thanks for bringing up Iowa, Jack, because I grew up there as a child. Moved to Northern California when I was 13. My mother was from California, my dad from Iowa. So seeing the difference now from the younger cousins growing up to when I was a child back there, there's so much hope in these young people making changes for others. I have a young cousin who's a gay man married in Iowa, which in the old days, you didn't hear about that so much. And it was really hard for them to tell his grandfather. But to see, I was so proud of how his grandfather handled stuff, just accepting that where in California, we had no problem. My mom raised us differently than how you're raised back there. So you really see a difference when you are in different parts of the United States. And I think it comes down to how you're raised, about respecting people for who they are. And it was just, yeah, very, very interesting. I'm really proud of my baby cousins who are growing up back there. They're changing everything my dad's family was about, and I love it. Thank you.
Perfect. Thank you for sharing, Sherry. Are there any final questions before we move on to the activities today? Okay. Again, if any more questions come up, we have breakout groups coming, we have more discussions coming, so feel free to drop them in the chat or come off mute. But let's go ahead and move on to the next segment of our learning collaborative today. So I just want to give one more Zoom round of applause for Jack for his presentation. He'll be with us for these activities as well. So thank you for sharing your passion, insight, and expertise coming from both HIV and aging services. So now it's everyone's turn here. So your presence here today is really the beginning of what new partnerships can be. We have 3 activities to get you started in the partnership process. So we'll start with a Zoom quiz, a chat discussion, and breakout group discussions. So let's start with the Zoom quiz here. Before the quiz starts, take a look at this slide. So rank in order of importance, with 1 being the most important and 7 being the least important. So take a look at these different service options and think, in your area, rank the following services in order of what is most important and what is least important. And if you think of services that are not on this list, drop them in the chat, and we'll take about 15 seconds for everyone to submit their answers, and we'll go ahead and launch the poll. So just take a second. I know there's a couple of different options, so make sure you take a little bit of time to put what is most important and what is least important for your local clients. Okay. We'll give a couple more moments for people to answer and fill out the grid. Seeing some answers coming through. Okay, perfect. So case navigation or case management and insurance navigation currently have the most first priorities, as well as information and referral services, transportation. What I'm really getting from this poll is that it's really everything, right? So exactly, like how are we meant to do it all then? And Christopher in the chat is putting mental health, and Marin's putting housing. So both of those are also very important. So take one last moment to submit your answers, and we'll go ahead and end this poll. Okay. So for this, apologies for the kind of complex display of these results, but it looks like case management has 4, and the most important transportation assistance has 3, and information and referral services. But really the range of these services and the results shows that all of these services like are needed for our clients. So again, how are we going to achieve all of these? Because we can't do it all alone. We are only one team, we're only one organization. And keep in mind, a lot of people are already doing this kind of work, like senior centers, local area agencies on aging. So really the purpose of this session is to understand how can we connect with those agencies that are already doing this work. So thank you for your participation in that Zoom quiz. So now in the chat, or feel free to come off mute, of the services named here, what is one service you cannot currently offer or provide a referral for? I know housing and mental health services was also in the list, so feel free to consider those as well. So what are the different services that you really need to get in touch with that you don't have current existing relationships with? And we'll be using the answers to this to help curate some of our technical assistance as well. So this is not just a fun question.
I'd say home modifications,
Mhm. Absolutely.
but now
So,
that I know about Habitat for Humanity does some of that stuff, I
mhm,
might give them a call and find out more about that.
mhm, exactly. And I'm dropping another, I'll drop another link in the chat for the elder care locator, because that is a national database to help you find different types of aging services in your local community, whether it be for home modifications, for transportation assistance, or insurance navigation. And I'm seeing Shakina put transportation in the chat as well. So like good to hear that there are various relationships for us to start building after this training. And before we go into our breakout session, I want all of you to think about what would you like to know about potential partnering organizations. So as we're thinking about partnering, it can be a more intensive process than just, hey, so what do you need? What do I have to offer? How can we come together? It really requires alignment between the organization's teams, resources, and individuals. Like do we have enough time to do this? Do we have enough funding to do this? Are our systems ready to do this? Because if just imagine if you are a HIV service organization and you get a new batch of 50 people from a local aging service organization looking to learn about sexual health, that might require a little bit of planning. And then on the flip side, if you have a local aging service organization that needs 200 people from your organization to access transportation services, they might have to implement a wait list, or they might have to bring on more transportation contracts. So there's a lot more that goes into partnership building than we might think. So really, as we're going into this breakout, think about these different components, and we'll also have a tool at the end as well. And I'm also noticing that people are dropping off. So we have about 15 folks in the Zoom room still. So I think we can go ahead and proceed with just doing a large group discussion here. So no need to break out, and because the discussion itself is two scenarios. So one, how do you make HIV services more age-friendly? And two, how do you make aging services more HIV-friendly? So we're going to be scrapping the breakout discussions because we believe that both of those discussions are very important to have when we think about building partnerships between the two. So we're going to take about 20 minutes for each scenario, or about 15-20 minutes for each scenario, and going to discuss the different strategies and how can we take it back to our own work. So is everyone ready to get into the cases? Okay, cool. Perfect. Okay, so for this first scenario here, for HIV services, I'm going to read out the scenario and the objective, but feel free to read along and to take notes as well. So the scenario is Positive Futures HIV Services, a well-established HIV care and support organization, has traditionally focused on younger clients, but is now seeing an increase in older adults living with HIV. Staff members realize they lack experience addressing the specific needs of older adults, such as mobility issues, chronic pain management, and social isolation. They also notice that many older adults feel uncomfortable in the clinic's youth-oriented setting and could benefit from tailored support. So the objective for this scenario is design an age-friendly action plan for Positive Futures that addresses the physical and emotional needs of older adults. Discuss ways to make older adults feel welcome, reduce stigma, and ensure that the organization's services remain inclusive and accessible for older adults. And two, what partners do you need to bring in to conduct this plan? So as you're thinking about this scenario, please feel free to come off mute, raise your Zoom hand, put some ideas in the chat, and we'll be taking notes and making sure that we move through this scenario together and bring together an age-friendly action plan. And first up, Shakina, go right ahead.
Part of the Pennsylvania HIV Planning Group, I was a co-chair for the Intersectional and Innovation Subcommittee, and we created a stigma intervention, which we're hoping to get funded. And so we spent quite a lot of time looking at reception rooms in terms of anyone, but in this case, it's people aging with HIV, like having various ways for people to understand what stigma is, as well as how to identify it, how to file a complaint, all of the aspects that go into really kind of being okay wherever you receive services. And we don't know the outcome yet because we haven't been able to implement it. But we do have a large number of people living and aging with HIV in Pennsylvania. And we're hoping that it'll retain people in care as well.
Perfect. Thank you. So really what I'm hearing for that innovation program is starting from the first place that clients go into when they're trying to receive services, right? So that reception room, and making sure that that space has an opportunity to for people to express their concerns around HIV stigma, but then also making it a destigmatizing space as well. So thank you for that idea. And it is definitely important to make sure that there's destigmatizing language, images, and feedback mechanisms throughout the various places where we serve folks. And Christopher in the chat says, first step, ask why there's an influx in older adults living with HIV. There might be a pressing reason for it. One example I can think of is the clinic here in San Francisco, so Ward 86, there was an influx of older adults going to that public clinic because there were some shifts in HIV services as it pertains to older adults. So really understanding like why are these people coming here, so we can better understand their needs and how we can adapt our services to them. So thank you, Christopher. That was a great contribution to the age-friendly action plan. And then Sherry's saying to acknowledge a person by their name when they come in, unless you don't know it, ask how they're doing, smile, ask what they need help with, to really open up that conversation and have a warm, welcoming environment. Because no matter what, you don't know what people are carrying when they come into your clinic, when they come into your organization as they're seeking services. So just again, like Jack said during his presentation, meet them where they're at so you can really understand what exactly do they need in this moment. So you can start with the immediate needs and then move on to more of the long-term needs, such as housing, home modifications, long-term transportation, and more assistance as you start to build that trust with them, right? So, and then Katie in the chat as well, ensure inclusive design, furniture, posters and visuals, and foster a culture of valuing our elders. And I really like how you put how you really put the physical space in there as well. So with furniture, do we have furniture that is accessible for older adults? Like if someone has a hard time standing up from a chair, maybe like a slightly higher chair will be easier, or making sure that there aren't high pile rugs and making sure that there are grab bars in the restrooms as well. And because there are all of those various pieces where people can do home modifications, but those also apply to clinics and to office buildings as well. So thank you. And Christopher in the chat, get funding to support a community action board for folks who have already started attending of older adults with HIV. And that is a really important piece that I want to repeat, is engaging the community of people who have that direct experience of what do they need, because as you build that relationship with your community action board or your or the different community members that are helping you guide your services, you have that constant connection of understanding, are we on the right track? So really working with your clients and working with your community, just so you're not assuming things of like, oh, like I went to this training and I heard that there was like transportation needs, but how much of that do your clients really need? So thank you for bringing up the community engagement aspect. And Arlene, I see you have your hand raised. Go right ahead. It's good to see you.
Hi, can you hear me? Good morning.
Good morning. Yeah, we can hear you.
I just have a comment and a concern. Because JB, I'm pretty active in LA County, and I'm a person aging with HIV, and I've had to have my furniture, everything modified, et cetera, et cetera. But what my concern is, I have heard about a lot of services. I know it's funding for aging, and especially aging with HIV. Heard it at the different conferences I went this past summer. However, my local, and I think there's only one, I have to research it. I think it's only one senior citizen place, maybe two, in Santa Monica. They have no idea what I'm talking about. None whatsoever. None, even for aging, not to mention HIV. And I feel a need to make a change there, because the case manager has no idea what I'm talking about.
Exactly.
So that's what I wanted to share, because it should be, in a place like that, a senior citizen place. You should know about the services that are available to not infected and affected. I mean, period. I would think.
Yeah, and thank you for bringing that up, Arlene, and your experience dealing with services even in LA County. So I think even as we say that, oh, we're in a bubble here in California or a bubble here in San Francisco or LA, there are still people who do not know much about aging with HIV. So that is really where the education piece comes in. Sometimes that falls on us as the training organization, and that's really our job. But then also, like, unfortunately, it's oftentimes falls on the client as well. So how can we make sure that we're all doing our respective jobs in informing the greater service sphere of these different service considerations of what it's like aging with HIV, and what exactly do we need to make sure that our services are inclusive? Like Jack said, like making sure that we're really utilizing senior centers and senior services for their intended purpose, for addressing social isolation, for building community, and for helping people age with dignity and grace. So how can we get there to make sure that these services themselves are welcoming and accessible? So thank you, Arlene.
Well, I have an idea. I mean, I think it should be in services and training for the staff and the case managers there. And I like to be part of that. But and as well, in addition, maybe some focus groups to find out what the needs are.
Yeah, absolutely. And there's different ways to go about this, right? As we're talking about community action boards, as we're talking about focus groups and in-house training. So there are various ways to help deliver that information, and it's our job as a care and wellbeing center and a training organization to help do that training. So as we're thinking about future training opportunities, in-person trainings are definitely on our mind, and making sure that we connect with those organizations that really need the training, right? So that is on our plates to really build that connection with more senior services. So because we can talk to the HIV services all day about HIV and aging, but really building that bridge and connecting with aging services, I think, is where a lot more of the work is. And I want to thank you and everyone here today for taking that first step, and encourage you to reach out to local aging services and build those collaborations as well. And I know there's a lot going on in the chat, but Nora, you've had your hand raised for a minute, so go right ahead.
I think this kind of piggybacks off of what Arlene had to say. But I know for myself, people don't know anything about HIV and AIDS anymore. I worked for an HSO, and when I started my job, a huge portion of my friend group was very concerned that I was going to catch HIV or AIDS from working with my clients. And I feel like public education in general would be important. But if we're going into a new space, I think educating the staff and the partners there could be very beneficial so that there isn't that stigma of, okay, this is their label and, you know, this is the only thing we know about this person, and just discounting them because of their diagnosis, and really kind of crush that stigma piece by educating people.
Perfect. Thank you, Nora. And Jack, do you mind explaining a little bit more as we're talking about the trainings needed for both sides? Because I know that was on your slides, but do you have any examples from your previous work at Joslin Center, at over in Long Beach or in San Francisco?
I'm sorry, what was the first part, the trainings?
Yeah.
Okay.
Yeah. So do you have any ideas for the audience of, like, you're trying to engage newer organizations, right? So building that relationship to have a in-house training. Or Nora, you have your hand raised, so you can go ahead and clarify.
Sorry, I just forgot to lower my hand.
Oh, no, you're good. Okay.
I think, training comes in a lot of different suits, a lot of different ways. And I think some of it can be formal training in person, particularly about, like, I was surprised to hear about the Santa Monica. And that may come from the fact that it's a city government run organization. And so the individuals there may not be fully aware of their, who needs to access their services. But sometimes training can come from just being there. Like the Santa Monica issue, I thought, okay, that's an opportunity. And it's an opportunity to go in and start bringing up the issue, and letting people know, and particularly if it's a government, there are ways to advocate. But I think that training can sometimes be putting people or having people get in touch with and learning about individuals living with HIV just on a one-to-one basis. That training a lot of times comes from, because the need for training a lot of times comes from the fact that the people have not been exposed, if you will. That's the wrong word, but they haven't been around older adults living with HIV/AIDS. And I would guess that in many circumstances, they probably were and didn't know it. So I think, actual one-on-one trainings, if the organization is open to it, and also full staff trainings. I mean, we did do some staff trainings at Joslin Center that we talked about the needs and talked about the fact that, you don't need to be concerned about this. A lot of staff didn't feel there was a need for the safer sex kits and that sort of thing. And suddenly they find out, and even that, the safer sex kit sitting in the lobby can be a form of training, because it lets people know that it's something that's being addressed and it's there to talk about. or putting a symbol or a flag or the gay flag or LGBTQ, we did that. We put that on the door. And some organizations here have just put a flag out in front of their business or organization, and that's a symbol, and that is also a part of training, is that people see that as, oh, this is an opening, this is a way that this is a place where I'm welcome. So those are just some of the thoughts off the top of my head.
Thank you, Jack. And yeah, amazing to hear about the work that you did over at Joslin Center, because what I'm hearing is that there was that initial resistance, right? Of like, oh, these services aren't needed, or like, oh, this isn't an issue. But then really bringing your staff and bringing your team to the same page of like, oh no, this is also a concern for the community, and it is our job to serve folks. So how can we do that? So thank you. And Bill, you got your hand raised, so go right ahead.
Yeah, hello everybody. Bill Bloom, San Francisco Department of Public Health, HIV Health Services. In regard to your question around the training, we've actually are in, San Francisco is a large city with kind of complex number of health services. So what we found helpful actually is we've organized a multi-departmental group consisting of Mayor's Office of Housing Community Development that administers HOPLA, us in DPH who administer HIV care services, as well as health service agencies, disability and aging services. So that's a lot of acronyms spelled out, and we meet monthly. We spent a lot of time cross-training both of our staff and our contract providers as to what the services are available. So for folks, it sounds like the larger part of this group are both consumers of services and service providers. Consider asking the grantees for the Part A's, B's, C's, and D's, and F's, as well as aging and adult services, to ask them to convene and meet together, because a lot of the work we within the administration should be doing and supporting the community. And if anyone's interested to hear more about our collaboration, I'm happy to provide that information.
Thank you so much, Bill. And again, a lot of great work being done here in San Francisco, but it is a result of the very complex system that we live in. So like, as much as we can come together to meet and understand each other's systems and each other's priorities, all the better. So creating that either monthly meeting or even quarterly meeting to start to keep a temperature check on what are other people doing to serve our respective communities. And I know there was a lot in the chat as well. So also around sex education, both in school and medical school, and the state's doing TV commercials to educate older adults that HIV and sexual health is still an important topic. So absolutely, like, all of those components are various ways for us to achieve our goals, right? So how do we want to conduct this education? Do we want to do a TV commercial? Do we want to bring in a community action board to share their stories? Do we want to go the more healthcare education route and get into the colleges and institutions? There are so many different ways to share this information. So understanding like what is your group the best at, and how can you utilize that to spread this message and importance of HIV and aging. Okay, perfect. And I think that was a great conversation on the HIV services scenario. And thank you, Bill, for dropping your email in the chat. So if there are no further contributions, we'll go ahead and move on to the aging service side now. And I know we have a lot of HIV service folks here. So as we're thinking through this next scenario, put yourselves in the shoes of the aging services side. So what exactly, like, how would you want to engage in this building partnership? Or if you do have experience building partnerships with aging services, this is really where you can help bring out some of those experiences and share it with the audience. So first, the scenario being Golden Year Senior Center provides a range of services for older adults, including recreational activities, health education, and meal programs. Recently, some staff noticed a lack of awareness around HIV-related issues, especially as more adults living with HIV begin attending the center. Some clients face stigma when disclosing their HIV status, and the center has no formal policies or education about HIV prevention, transmission, or the needs of people aging with HIV. The objective is to develop a plan to make Golden Year Senior Center more HIV inclusive, consider what staff and client preparations are needed to implement the plan, and discuss the steps that the center to ensure that the center is welcoming and supportive, and what partners would you need to bring in to conduct this plan. Again, I know we have a lot of HIV service folks in the audience, so you need to list yourselves as one of the partners. But now thinking about the aging service side, so a lot of the things that we discussed previously around education, but how do you want to help potential partners build policies or conduct more education? And again, bringing in that community engagement piece as well. I think Jack, if you don't mind, I think this is also a great opportunity for you to share a little bit more about how has Jocelyn Center during your time there like really engaged like people living and aging with HIV and building those partnerships.
Well, I was going to say that I think the operative word in this scenario is develop a plan. Again, not expecting you're going to go from A to Z immediately. So what are the steps that you can do? And some of the things that we did was, as I mentioned earlier, to bring in the safer sex kits, to have HIV testing available. And that is a way to bring the issue to the forefront, and also to assess if there are if there's going to be any resistance and what that resistance is. And out of that, you can then start developing trainings or workshops or other ways to overcome that resistance or talk about stigma. And I found, at least in the work that I've done, is when I talk about stigma, I try to put it in so the other person can know what it's like to experience it. So, for older adults, for people that when we had the transgender individual working with Mizell Center, I mean, yes, ultimately she was embraced. Initially, there were some issues, and it's like, okay, let's put the shoe on the other foot. How do you feel when you walk into a place, whether it's a social gathering and you experience ageism? And the reality is we're humans, so that feeling of being subjected to stigma, whether it's ageism or stigma related to being transgender or HIV, my guess is, and in talking with people in the mental health profession, the feeling is the same. And so helping people understand what it feels like to be to experience stigma, whatever it is. So many times using that method, I've seen the light go off in people's heads. Oh, I wouldn't want to do that to anyone. Or I wouldn't want to have anyone feel that way. So I think, that's one of the first ways, but slowly introducing it, particularly in areas where you feel that there may be resistance or something like that. But we're doing HIV testing in next month, and every week in your email newsletter or whatever, letting people, your whole constituency, know that you're doing that. That's education, and that's laying the groundwork. But I think, again, the plan is, okay, we're going to start with HIV testing, and then we're going to start with safer sex seminars. And I think that's a way that you can bring people along to your ultimate goal.
Perfect. Thank you, Jack. And again, the key part of this scenario is making that plan, right? So I wrote down some steps as you were talking, and first doing that introduction of like, this is who we are, this is what we do, what do you do, and what are some of the opportunities to help support your community with comprehensive wellness, especially around sexual health. And then doing that assessment of, oh, what does your community need? How can we help serve that? How can we address that need together? And like you said, starting off with some HIV testing at an event or condom distribution, or just like having a table to help to help build that introduction of this is who we are and this is what we do. And as people have more excitement or interest around it, to build off of that and put in some more work around more intensive partnership activities, such as in-house trainings, safer sex webinars, and then really taking it from there. But the last and really important part of that is helping people understand what it feels like, and building that connection between HIV and aging services of, we're all here trying to fight stigmas, we're all here trying to fight ageism, and we're all trying to build that connection and community for people as they age. So really posing your purpose in language and in situations that the other people can understand and really engage with. So thank you for sharing that, Jack. And there's some suggestions in the chat. So Christopher's saying center staff should go through sex education so they don't accidentally share misinformation, and to clarify that they aren't and don't have to be sex educators. And again, that's where HIV services can come in. You don't have to do a complete like HIV test counseling training for your staff. We already have that going on over at the HIV Service Center. So how can we work together and maybe you bring HIV testing to the senior center once a month or once a quarter, and really making sure that that role clarification is there from the beginning, so potential partners don't have that, oh, like, are you being asked to do all of these things? It's like, no, like we're already doing a lot of these services, so how can we come in and help you? And then for Shakina putting in the chat, like here in over there in Pennsylvania, you work with the Pennsylvania Department of Aging, SAGE, and area agencies on aging to educate centers on HIV. And again, like really going to the senior service centers and educating them on the different components of living and aging with HIV, and dispelling a lot of those assumptions, right? So, and seeing that older LGBTQ people who are going back into the closet to avoid stigma and being discriminated against, like that is also very real. And and that's again where the importance of that culturally tailored care and that culturally tailored training of understanding that there are a wide range of older adults. Like, how can we make sure that everyone feels welcome, that everyone feels invited and safe in our service spaces? And it also gets to what Jack was saying earlier about sometimes we have that internalized stigma, whether that's around HIV, whether that's around being 70 or 80, whether that's being an LGBTQ elder. So it's both and, right? So creating that safe, supportive environment and having those clear markers and actions um, to to um, to make that environment welcoming, but also helping the clients themselves um, work through that stigma and being discriminated against, because that's going back into the closet process um, is quite a tricky thing to help people through. But I think that's what comes with some of us just being who we are out in this world. There's going to be that repeated coming out. There's going to be that repeated sharing and inviting people to come in and connect with you. But we can't let that fear inhibit us from connecting with people, right? So it's that part where although we do have to come out, it is our choice to do it and when we do it. So again, like making sure that you're building those safe spaces for people to be themselves. And Sherry dropping in the chat a monthly drop-in class on stigma of all kinds, and really educating people on what does this look like for, let's say, like an LGBTQ elder or like a black elder who has like 3 generations to take care of, and testing it um, and I think MH stands for mental health. Feel free to clarify that, but anyone that can pick up and be mailed to people with resources listed. So thank you. And then go ahead, Shakina.
I've been vocalizing my concern around other people who are also in aged care facilities. You know, we are sexual beings. People are able to enjoy sex throughout our older life, and some people, you know, may not have experienced a diverse group of people. And if you find yourself in an environment that's new to you and it's a bit alien to see members of the community that you've never interacted with, I think there needs to be some guidelines to follow, like if discussions around sex come up, you know, at the dinner table, or some people have connected dots that so and so and so and so have had sex, to stop the rumor mills, the gossiping that leads to the stigma, which leads to, you know, staff being overwhelmed by having to navigate those kind of issues.
Mhm. Mhm. Yeah, thank you. Um,
Um,
yeah, go ahead, Arlene.
I'm sorry, I'm driving. I mean, I just parked, so I couldn't put up my hand. And I just wanted to add, well, not add, but just agree with both what you and Jack said. And I like what Jack said, gave me some ideas. But I think it's really important that, again, they train people, and especially us living with HIV, how to go in and have these conversations. Like, for instance, I've been living in Santa Monica about 8 years and been with the senior citizen. I just felt empowered enough to share with them my status and inform them of the resources that I've learned about. I've even, um, joined, well, I applied to join for my local committee in Santa Monica to get in there and to be able to make some changes. But I really like what Jack said, that, you know, we could teach, which is very important, teach and draw people in what stigma is and how that feels as a human being. I really, really, really like that. I think that's really important. And I think that because we, like you said, we have testing everywhere. We have this and we have that, but they still don't know how to deal with older adults, whether they're HIV or positive or not. I heard somebody say, yeah, they think that they assume that we don't need sexual education as we're aging. But, we all know that's not true. So I just wanted to come in, Jack, for saying that because it learned me something just now, and that's important too. But it's really important to get with your local politicians and local committees because the AIDS organizations are already doing but so much, and some of those AIDS organizations, they're learning how to deal with us that are aging as they go along, because we the new generation of aging, so to speak. So I just wanted to say that, and yeah, I plan on using all the information I hear today and coming up with a plan to move forward and eliminating stigma and discrimination as it pertains to aging and HIV, or HIV and aging, whichever one comes first. Thank you.
Thank you, Arlene. And it's great to hear that there's a lot of ideas going around at the group and how we can build more partnerships and make those connections and really understand like how we all go about our work and what our priorities are, and letting people in of like, this is what aging with HIV feels like, this is what aging feels like. Because at the end of the day, we really do want to build that inclusive, supportive community that is free of stigma, whether that be around HIV, whether that be around aging, whether it be around our race, ethnicity, sexuality, gender. So thank you everyone for your insightful contributions to both of these cases. And again, thank you, Jack, for offering your experience and expertise today. Do we have any final contributions towards this case? Any last comments on the presentation, on these activities before we move on to closing out the session? Okay, perfect. Well, if there are any last thoughts or pieces of insight, please go ahead and leave them in the evaluation. We'll be sending that out over email as well. But lastly, I want to share that we'll be distributing a tool with the evaluation, and it will help you really make those plans to build partnerships between HIV and aging services. So really, what are your own partnership goals? Having some questions to understand other people's partnership goals, and what is the fit for our partnership activities, right? So what is our mission? What is our vision? What are some of our shared goals? And how can we really move forward to establishing workflows? And Jack, before we close out, go right ahead.
Well, I just wanted to take this opportunity to thank you for inviting me to do this. I always learn a lot when I prepare for these sorts of things, and I've learned a lot also from listening to some of the participants, and to thank the participants for taking this time out of your day and spending time and listening to me. I really hope that you have gotten something out of it. I think my contact email was put into the chat, and I certainly encourage you that if you do have questions that you think I might be able to help you with, please feel free to get in touch. But I'm really honored to have been here and honored to have been among some great individuals that are participating in this program. So thank you.
Thank you, Jack. And yeah, we'll provide Jack's contact information in the follow-up email as well. But to close out this session, please fill out our evaluation. Constance is going to be dropping that into the chat. These trainings are free of charge, and we want to make sure that any future learning opportunities stay that way. So we use this evaluation to help build a case with our funders, with future partners of this training really matters and this training really works. So in the evaluation, if you could please provide any positive experiences, things you're taking away, and how you're going to be utilizing this information. And we'll be distributing the recording and the tool like once we reach our evaluation goal as well. But again, thank you everyone. Thank you, Jack. Thank you all the participants. Thank you for taking the time out of your day to join us on this Thursday. And we hope to see you in future trainings. And if you need any further assistance, please feel free to reach out to the Care and Wellbeing Center. And just one last round of applause for Jack. Thank you for sharing your expertise and your experience. And it was truly invaluable to better understand how you're bringing together both the HIV and aging service spheres. So again, thank you. And with that, this closes out the session. So enjoy the rest of your day, everyone, and we'll talk to you soon.